So, hello everyone, I'm Norma Ramos and I just wanted to, I'm Norma Ramos, I'm the Senior Associate Director for the Institute for Policy and Civic Engagement. I want to welcome you to our Civic Engagement Lunch Talk. I just want to kind of share a couple of quick things before we get kicked off with our lunch talk in terms of also just sharing a little background about our Civic Engagement Research Awards and our lunch talk, and the purpose of our lunch talk is to think about ways for us, our institute, to support research from UIC faculty that centers on the concepts of practice and methods of civic engagement. And so we've been supporting research awards since the very beginning, I think 2009. And then part of the Research Awards program is that we invite faculty members to come back a year later and present some of the highlights, maybe some takeaways, some next steps based on some of the research they were able to do under the award grant. So this is sort of the part two of all of the fun work that faculty are doing here, and it's an honor to be able to find an opportunity to showcase and highlight UIC faculty in that way. And so that's just a little bit of background about our UIC Research Awards. The other quick housekeeping tips are that there is lunch in the back for you all. Please feel free to help yourself for lunch, and there's water. And then there's restrooms all the way down the hall if you just walk right out this building, this hallway here, and all the way down to your left. We also are recording the session in terms of the actual presentation session part of it, but we won't be recording the Q&A, so just wanted to give you all a quick highlight on that. We'll be featuring some excerpts and some snippets of that on our YouTube page. So just wanted to kind of share a quick background about our lunch talk and kind of get us kicking off here. So today we're super excited to hear more from Dr. Clarno and his team to discuss movement-led research through the lens of collaboration between the UIC research team and the Collaborative for Community Wellness. So I would like for you all to join me in welcoming Dr. Clarno and Shakura Evans to present today's lunch talk.
Thanks, Norma. Thanks, Joe. Thanks to all the IPCE staff for supporting this work, along with the Institute for Research on Race and Public Policy. Y'all do so much to make the work possible, so we really deeply appreciate it. We also want to thank the Consortium for Community Wellness, the research team there, who worked very closely with us throughout this project, and to our entire research team. Shakura and I kind of helped facilitate the project. We had a really robust team made up of grad students in the sociology department. Erin Arikana, Maria Shaverikova, Tim Johnson, Aisha Lehman, Tirza Aparkamradi, Ren Rousseau, Saeed Safar, and Soleil Smith. So this is a big group project. So what we're going to do, I'm going to talk a little bit about the methodology. Shakura is going to speak about the research itself, and then I'll talk again a little bit more about what were our findings and the impact and how we approach it. So there is a QR code on the tables, but also here if you want to kind of get a copy of the report. I'm sorry we didn't bring any paper copies with us today. It is easily available. So the methodology that we use, I call it movement-led research. This is something that several faculty here at UIC do. Nicole Wynn, Nadine Naber, there are several people who do work that's closely connected with community movements. So, we in our report, we define this as a collaborative, community-engaged methodology in which university-based researchers partner with community organizations to produce research that can support mobilization for social change. So this is, very explicitly about partnerships with movements and research support, providing research support for campaigns, ongoing campaigns. In a previous work that I facilitated, we formed a research team called the Policing in Chicago Research Group. They work very closely with several different organizations in Chicago. Black Youth Project 100, Organized Communities Against Deportations, the Arab American Action Network, Circles and Ciphers, as well as some big campaigns, the Erase the Database campaign, the Expanded Sanctuary campaign, and the End SARS campaign. these began as conversations that I had with kind of key organizers within each of these different movements about kind of whether they could imagine partnering with a university-based research team to provide support, research support for the movements. And you know, the conversations were very interesting, and one of the kind of key things that people kept saying is, look, we're really not interested in hosting a student or supporting a student who's going to study our movement. Like, we're not really interested in kind of spending time doing that. And we said, you know, to clarify what we're talking about is partnering with the organization to study the state. And everybody was like, yeah, okay, that I can get on board with that. And so that became really like a basis for our methodology. You know, it was very collaborative. Collaborative both in the sense of it's not an individual research project, but we build a research team and community engaged. And also it involves partnerships with organizers outside of the university. It's community engaged, working deeply in dialogue with community partners. And we refer to it as movement-led because we take direction from organizers. We try to create structures of accountability to ensure that we remain accountable to our partners and connected to their campaigns. So they help shape the research questions we ask, the data collection process, the analysis, the reporting, all of it. So for this project, kind of building on that previous work, we began a dialogue with the Collaborative for Community Wellness. The CCW is a coalition of mental health professionals, of community organizations and residents that since 2017 has been working to transform public mental health care in Chicago. The big focus is upon kind of reopening several public mental health centers that were closed under Rahm Emanuel, and then removing police from the mental health crisis response system. So this is something that the campaign is colloquially known as treatment, not trauma. The organizers behind it are the Collaborative for Community Wellness. They have a research team that's constantly doing research, community-based research, producing reports that can inform their vision, their demands, and their mobilizations. And we began a dialogue with organizers from CCW in 2023. This built on partnerships that had emerged out of relationships that had emerged out of the Policing Chicago Research Group. In particular, the Brighton Park Neighborhood Council was deeply involved in the Erase the Database campaign and has been kind of a cornerstone of the CCW from the start. So they were familiar with us, familiar with the methodology, and from their own research teams. And so we looked to open a conversation about ways that UIC might be able to support their work.
So in the spring of 2023, CCW surveyed 650 residents across the Chicago area, where they really wanted to get a sense of how folks envisioned an ideal mental health crisis response system. And so the final question on the survey asked respondents if they had a story that they would like to share about a past experience with mental health crisis response. And so, as Andy was saying, in collaboration with CCW, this is where our research team kind of stepped in, and we agreed to conduct interviews with people who offered to share their stories. So, our research team, as Andy mentioned before, consisted of graduate students who were enrolled in the SOCH 501 research practicum. This research practicum, this SOCH 501 is the first of a two-part research practicum that is required for sociology graduate students, where the first part, 501, focuses on designing a research project and collecting data, and the corresponding 509 course would focus on analysis of the data that is gathered in the 501 course. So this particular 501 course that was led by Andy focused on qualitative research approaches. And because of the nature of this particular topic, we wanted to emphasize trauma-informed research techniques. And so especially, so the research and the trauma-informed research techniques really, we wanted to emphasize and center that all of these that all of these people could potentially have a traumatic experience, and we wanted to make sure that all of these experiences were met with care, empathy, dignity, and respect. And so in response to this, we took steps such as creating a resource guide that had different mental health resources across the city. And we also had a team of on-call mental health professionals, just in case, for all of our interviews. So in case there was an emergency, we did have a mental health practitioner on call that we could reach out to provide assistance. That also, our trauma-informed research technique also extended to our research team. So we also wanted to be mindful of ourselves as researchers, because collecting this data, doing this type of research can be traumatic in itself. So we implemented check-ins with the interview team, and we also made sure that we emphasize self-care and doing things to decompress after conducting our interviews. So after the spring, this project continued into the summer and the fall of 2023, where our research team conducted interviews with 23 people in the Chicago area about their experiences with mental health crisis response, specifically asking about their access to mental health services, sharing their stories and their experiences with mental health crises, and what they envisioned as a more just and effective mental health support and crisis support system. Some of these, actually many of the respondents shared their own stories. However, some of the other respondents shared stories of loved ones, so close friends, family members, and we also did a few interviews with professionals who reflected on their clients' experiences. And so just really quickly, just a quick demographic breakdown of our sample. So we did 23 interviews total. 9 of those interviews were with Black individuals, 7 with white individuals, 6 with Latinx, and 1 with Asian American. And then we also have a gender breakdown of our demographics of our sample as well. And you can learn more about our sample and kind of how we did this work in our research report, which we have a QR code for on the table. So I'm going to go ahead and turn it back over to Andy.
Thanks, Shaquilla. So I want to walk through some of the findings from these interviews, which, we worked collectively during the second course of this 2-part sequence to analyze the interviews and to pull together this report collectively. So the first finding that I want to focus on is that the mental health crises take place in crisis conditions, right? The elimination of stable jobs, union wages, public housing, public education, mental health care, and other social services has deepened the everyday crisis conditions confronting Chicago's Black, Latinx, and working class communities. In 2012, the Chicago Department of Public Health closed 6 of the 12 remaining public mental health centers as part of an austerity agenda. This marked a real intensification of the divestment, which had begun as early as the 1980s. And during that same time period, right, investments in public funding for police has steadily risen. So we got to the point that by 2022, Chicago invested 1,000 times more in the police department than in mental health care. So with cuts to mental health services and increasing police budgets, the Chicago Police Department became the city's default first responder for mental health crises. Right? And that leads into the second key finding. Within this crisis context, mental health crises are inevitable. And whenever they occur, respondents explain to us that they often feel afraid to call for help because they know that the first responders are police. People express fears that the police response will be dehumanizing, will be violent, and will be otherwise traumatic. And these fears stem from both personal experiences as well as their awareness of cases that have received a lot of attention. Various different police murders of people experiencing mental health crises. So Jesse, a white person in their 20s, explained the dehumanizing treatment that they expect to receive from first responders. Jesse said, one of the things that I dreaded the most was interacting with first responders because I was like, you're already at one of your lowest moments. And then there's some people treating you like your work that they don't want to be doing, like you're a nuisance or a bother. Caroline, mother of a black child, recounted, "I would never, ever call unless my son's life was threatened. Even if my life was threatened, I wouldn't call 911 because they're going to send police, and that's going to make everything much worse." And we hear these kinds of things over and over again, and they're all documented in the report. But despite this fear, many respondents felt like they had no option other than to call 911. And so many of them did, either for themselves or for someone else. And so this really suggested that people would be much more comfortable with a crisis response system that didn't lean on police. The third finding is that when police are called, right, according to the people that we interviewed, their response tends to escalate crises, it relies on criminalization and violence, and it dehumanizes and stigmatizes the person who's experiencing the crisis. Sarah, a 61-year-old black woman whose daughter suffers from mental health symptoms, described the police as not equipped to handle her daughter's episodes. This was a frequent refrain we heard from respondents in the survey, from the interviews. They often noted that police lacked the skill and the training to handle mental health emergencies. Whenever police did intervene, right, respondents pointed to these three concerns. First, they said that the way that police respond tends to escalate a situation. They're often quick to assert their authority in order to reinstate order, violently if necessary. And in doing so, they often provoke individuals who are experiencing a mental health crisis. David talked about how the police response would always escalate his sister's mental health crisis. He said they don't have to come so deep with so many people. He's talking about a dozen cars showing up at the house. They don't have to come so deep with so many people so as to alert the whole neighborhood that something's going on in my house. It doesn't have to be like that. Because that's just really inciting the person. That makes them even more ready and willing to do things and say things that are outrageous because they're being stimulated by that process. Escalation often leads to criminalization and use of violence by police. So despite the fact that a person experiencing a crisis often doesn't pose a threat, first responders tend to rely on violence to establish control over the situation. And the most egregious example from our interviews, Kim, a 29-year-old Japanese Filipino woman, was having suicidal ideations, but she was unarmed, naked, and taking a shower in a motel room when police intervened, barged into the room, handcuffed her, and strapped her down, and took her to an ambulance. Michael, a mental health professional, told us, "I'll be honest, we've had several clients who met up with police and they didn't survive." Another significant aspect of the coercion and violence takes place when first responders describe a person who's experiencing a mental health crisis as, quote, a threat to themselves or others. Right? Through that designation, first responders can strip away the person's agency and involuntarily send them to inpatient care or prison. Another critique, the third point, right, about dehumanization and stigmatization is that, right, these first responders often dehumanize and stigmatize people. The people regularly use the term subhuman to describe the treatment that they received from first responders. In the words of Jesse, a white person in the we already mentioned Jesse, if you see it and experience it, the felt sense is that you're treating this person like a subhuman. Kim, the Japanese Filipino woman I described, said that the cops were treating me like I was a piece of shit. And we need people who will stay calm and not panic and not treat us like a dog. The final piece that we want to talk about, the last of the findings, is about the aftermath of the crisis. Because people just talked about not just the crisis moment itself, but what happens after. Right? In sharing their stories, many people talked about how in the aftermath of a crisis moment, people are often taken either to jails or to hospitals and inpatient facilities where they experience further dehumanization and coercion. One of the primary critiques of, we speak a little bit in the report, we talk a little bit about jails, but most of the focus is on hospitals and inpatient facilities, which most of our respondents had experienced. And they all described it as a very dehumanizing experience that also took away their sense of agency. Again, through that description of being a threat to yourself or others. So if a doctor just deems a person a threat, then they can involuntarily commit them to inpatient care, even when they express disapproval and don't feel like that's what they need. Much like their experiences with first responders, many of the people that we spoke with shared stories about dehumanization and stigmatization at hospitals and inpatient facilities. They're often denied their rationality as reasonable human beings, and again, are treated with that category of being subhuman. So at the very end of each interview, we spent some time, and this was part of the trauma-informed process that Shakura was describing. We spent some time trying to not just end with these really heavy stories, but to talk about what people think the system should look like. Right? And so people spend time sharing their visions for a more just and effective mental health care system. According to the patients, according to the respondents that we talked to, the system should involve really three key things. First, meeting people's basic needs. People talked about a just and effective mental health care system would begin by meeting people's basic needs for stable housing, nutrition, job training, and healthcare. Right? Second, that it would provide accessible, high-quality, community-based, and destigmatized care. Those were the key terms that kept coming up. People talked about community spaces for healing, where people can care for one another. They talked about reopening the closed mental health centers across the city and expanding staffing and operating times to make them more accessible for people. And they talked about transforming the practices within these facilities, right, to ensure that staff treat people with full respect and decency. And then the last is everybody talked about an alternative crisis response system that did not rely upon police, and it focused on non-aggressive, collaborative practices that center the person who's experiencing a crisis. Most of the respondents insisted the police should not be involved in mental health crisis at all, which aligns with a survey that CCW did in 2023, where over 3/4 of respondents, 77%, said that they thought only mental health professionals should respond to mental health crises, if not police. Carla, a Latina who works in a nonprofit community services, shared with us, we don't need police, you know? We need someone who can calm us with words or breath or just staying by our sides. Many people talked about locally staffed crisis response teams and teams that would be composed of mental health professionals. They talked about wanting first responders to focus on de-escalation and taking non-aggressive approaches. And they were adamant that responders refrain from criminalizing or stigmatizing the people who are experiencing crisis. So we released this report with the CCW. You'll find it on CCW's website. We released it in January 2024. And it concluded by echoing the call to reopen public mental health centers closed in 2012 and to fully reimagine the way that our city supports residents with both daily mental health care and crisis care. To make the system work better across the city, the report concluded our mental health care and crisis systems should be more collaborative, individualized, and community-based, while also rooting out stigmatizing, dehumanizing, and criminalizing aspects of the system. Throughout that spring, this was last year, 2024, throughout the spring, the CCW held what they called listening sessions across the city to learn more about people's visions for an alternative and more just and equitable mental health care system. Many of the visions that emerged from those sessions amplified things that were in the report that people had shared with us. Meanwhile, the CCW, right, had been advocating for many years to transform public policies around mental health care. And they were in deep conversation with Mayor Johnson last spring about instituting some real changes. Johnson had been a vocal supporter of treatment on trauma during his campaign, and the CCW was part of a working group that he appointed to review the public mental health policies. So in that role, they were able to use the research that their research team had been doing and to bring our research to the table as well to advocate for some real changes in the policies. And that came to fruition, it began to come to fruition last May. when Mayor Johnson announced plans to reopen 2 public mental health centers and to expand non-police crisis response systems. And then just this January, that promise was fulfilled when the Roseland Health Hub was opened on the far south side. But the change is slow, and the issues that people that our respondents talked about remain urgent and needed changes. So the campaigns to transform the city's public mental health care infrastructure are continuing. But I want to highlight these changes to really just demonstrate the promise and the possibility of what we call movement-led research. And we'll end there, just note one thing, that 2 of the research team members, Aaron Arikan and Tirza Korradi, continue working with the CCW. They go to the meetings on a regular, and they're doing other research that builds on this, that is also in conversation with the work that the local organizers are doing. So it's also creating pathways for supporting students doing dissertation research as well. We can stop there. Thanks, everyone.